Alberta Health Services wants all Albertans to live the longest and healthiest life possible. Strategic clinical networks will have a direct impact on patient care by leading us in creating the best performing, publicly funded health system in Canada.
Depression is a very common problem.
And in fact, of all of the mental disorders, it's the single most common diagnosis.
So we're talking also about a large proportion of the population.
Each year, approximately 200,000 Albertans seek medical help for depression. As the name suggests, the Addiction and Mental Health Clinical Network is a province-wide group of mental health professionals and clinicians who have come together to improve care for mental health patients.
Well, I think the goal is largely to bring some degree of standardization to activities taking place across the province. It's also about, sharing experiences, successes, and trying to work on these problems in a way where what's going on in one part of the province can really benefit what's happening in another part of the province.
One of the initiatives for the network is the creation of the Adult Depression Pathway.
Depression pathway is really a set of decision rules about how to assess and intervene with depression at various stages, both in terms of severity and length of time that a person is depressed.
I found that the adult depression pathway has made care of depressed patients more seamless. It's removed barriers so they're getting intervention sooner.
Very much the strategy is to support the primary care network. So what it really does give the primary care physicians more tools to work with.
The depression pathway certainly increases collaboration between colleagues. So the physician and I align ourselves together. We're working at the same goals. We're discussing in a very constructive way how to support each patient.
First and foremost, this is about patient care and about the patient getting the best treatment at the most efficient time in their history of depression.
I will say that it takes a little while to get comfortable with the pathway. However, as you work in the pathway, I believe that it really helps our comfort level in dealing with a number of the mental health conditions.
The advantage to the patient is that they get more systematic follow-up, and the steps that they go through will be well aligned with what existing research tells us.
As a clinician delivering the care in this scenario, I find that it's comforting, it's reassuring to know that applying our evidence-based and to know when to call in the next tier of treatment.
Because you can quantify, because you can follow, your comfort level becomes just as great as following a diabetic or someone post-heart attack.
The depression pathway really enables patients to access care. So it's timely, it's cost-effective, they're getting the right level of care for their impairment.
We're at the point in time in terms of the development of depression where we really do have evidence-based interventions. We really can apply them in the real-world setting, and I think we have a really good opportunity here in Alberta to develop a model that's going to improve patient outcomes, reduce healthcare costs, and bring healthcare in Alberta to an evidence-based strategy.